Good afternoon, everyone, and welcome to OHMM's March webinar, and thank you for attending. FYI, this webinar will be recorded, and later this week it'll be on the OHMM website, so you will have access to view it later. Today, our topic is the past and future, language, and the modernization of our laws. We will be offering CEUs today. I will put the link to the CEU evaluation in the chat shortly, and then I'll put it in there at the end as well. If you are seeking CEUs, please make sure that you complete that survey fully, and you will receive your certificate from us in the coming weeks. During the presentation, if you have any questions, put those in the chat or Q&A, and we'll be monitoring those. Today, we have a few different speakers. First, we have Brian C. Jones, who's been thriving with HIV for 38 years and has been a driving force for change for the HIV community in Ohio and around the country. We also have Dominic Dittweiler, a graduate of Ohio University and has been with Equality Ohio in various capacities since 2017, focusing his efforts at the State House to enact change. We also have Marguerite Showers, staff attorney with the Center for HIV Law and Policy, and is a member of the state bars of the state of Washington and New York State. And finally, we have Zach McCune, activist and public policy strategist, currently serving as public policy and civic engagement manager for Equitas Health. And with those introductions, I'm going to turn it over to Zach.
Awesome. Thank you, Adam, and thank you for joining us here today. So we wanted to set the scene by really introducing the Ohio Health Modernization movement and some of the members around this virtual table today. And one, we would also like to just thank you for your participation in the session and learning how these laws are used to persecute members of our community living with HIV, and find ways that we can work together to modernize the statutes in Ohio, to reduce stigma, and to put forth better public policy so that we could achieve better public health outcomes. All right, so who are we? As we mentioned, we are the Ohio Health Modernization Movement, and we are comprised of various community partners, organizations, advocates, and we have a presence from local advocates, like I said, all across the state of Ohio, but we also have great involvement from national partners as well that are helping us really keep a pulse on the way that these laws are being changed, amended, and repealed over time across the United States, and are really helping us inform our best practices as we move forward to modernize the statutes in Ohio. So specifically, OHMM, the Ohio Health Modernization Movement, is a coalition of organizations and individuals dedicated to ending the criminalization of HIV in Ohio. You'll see a few of the names of our partners represented on the screen. So I'll make specific note to those that are mentioned. So the Center for HIV Law and Policy is a national partner of OHMM and helps coordinate the Positive Justice Project, which is a national collaborative network of people living with HIV and allies working to end criminalization in the United States around HIV and all stigmatized disabilities and health conditions. We also have Equality Ohio, one of our great partners who serves to be an advocate for members of the LGBTQ+ community here in Ohio. They're a member of the Equality Federation, and they work to really make sure that the legislative and political landscape for people, the LGBTQ+ community is one that affirms our civil rights in accordance with their mission and their values as well, and they're valuable partners, as I mentioned. We have Equitas Health, which is the organization that I represent, a regional nonprofit healthcare organization founded in the HIV movement and has since evolved to be a full healthcare organization. And we have many other partners at the national level. I'll mention a couple of more: the CERO Project. We have Caracol, that Adam represents, who is our facilitator today, and many more. So we are very grateful for their advocacy and their efforts and their contributions to this work and all that they do for their respective communities. We're going to give you an introduction to our presentation, but more specifically, we're going to focus on these 4 learning objectives. We'll learn a lot today. We'll be able to stay in conversation. You'll be able to ask some great questions. I know for the CEUs, Adam has some great prompts that are going to be loaded into the chat, and there will be some quiz opportunities, but we really wanted to focus on these 4 concepts. So we're going to gain general information about Ohio's HIV criminalization laws, how they came to be, what they currently do, and our efforts to modernize. We're going to learn about those efforts to modernize by way of our proposed changes to these laws and how those proposed changes can impact people in the real world. We're also going to learn about some of the differences between our legislative strategy and questions you may have about legal strategy and how these laws are currently being applied and how our proposed changes will impact the work in courtrooms across the state of Ohio. And then finally, we're also going to gain an understanding of how to use this information to better advocate for yourself, for your clients, for your community members, to defend against the ways that these laws are currently used, and then to advocate for these proposed changes that we're going to outline for you as well. All right, so let's talk a little bit about the current landscape in the state of Ohio. So there are 6 statutes that actually criminalize HIV in the state of Ohio. So we wanted to focus on those today. And like I said, we're going to recommend these proposed changes. We're going to share with you why these are so harmful, how they're being used against members of our community as we move forward. So to give you a little bit of history on the law, it was passed in the year 2000. So people living with HIV have also been living with this fear of persecution for the past 21 years in this state specifically. And they really came to be at the height of the HIV epidemic. We're moving even beyond the height of the HIV epidemic by the time that these laws were passed here in Ohio. And they were rooted deeply in fear and stigma and a lack of understanding and information about HIV, even at that time. But what we know since is that the state of care, the state of prevention has evolved well beyond what it was in the year 2000. And so it is incumbent upon us now to take everything that we know to revise, amend, or eliminate some of these statutes to make sure that people living with HIV or who may be at risk of HIV are awarded the dignity under law they deserve. So these 6 specific statutes, we'll focus on them to varying degrees, we'll say today, but our proposed changes are going to address them. And what are they? So currently in Ohio, there is a penalty for blood and organ donation for people living with HIV. We'll get to why that shouldn't be in place to begin with, but there's a current penalty for those that are living with HIV who may donate blood and or organs. The current statute requires for an individual, if convicted under the felonious assault statute, which we'll get to in a minute, if convicted, it requires them to register as a sex offender. There are discriminatory penalty enhancements for solicitation, for loitering, and for prostitution. And of course, there is the felonious assault statute in place for failure to disclose one's status. I like to refer to this as a they said situation. Oftentimes, this is being used with limited information. This does not require actual transmission or intent to harm an individual as well. The language outside of these 6 statutes, or I should say really among these six statutes, there contains outdated and discriminatory language as well that we are also hoping to update as we go through the process of modernizing and advocating for these to be amended. I want to also draw a note to, while we are talking about the law, I'm a policy person. I've worked in this space before, but I'm not an attorney. So any bits of conversation that I offer today, an overview of these laws, is not meant to be intended or used as legal advice. We do have an attorney on the call, and we're happy to get you connected where necessary. But we really wanted to focus on the policy changes that we're proposing. Additionally, there are practical implications of this. If you're wondering how often does this occur, we really think that this is incredibly urgent, specifically in this moment, because we are seeing these statutes being used against people living with HIV in Ohio this very year. So a couple of weeks ago, I think we're 2 weeks ago now, there was an individual out of Dayton, Ohio, who was arrested and indicted on the existing felonious assault statute for allegedly failing to disclose his HIV status. There's also been some discriminatory language being used within the community to describe the actions that occurred without even proof of transmission. So the time is well beyond, it's well beyond time that we modernize the statutes, that we work to improve the existing law in Ohio. But to get a little bit more specific into how these have been applied, and why they are so harmful and unjust, I'm going to turn it over to my partner in the OHMM committee and a longtime survivor, thriver, and advocate, Brian Jones.
How's everyone doing? Before I get started, I want to give a heavenly shout out to Jerry Malico, who was very instrumental in this fight. He's definitely is missed, but he's with us here. And he was also very instrumental in the LGBTQ community. And so this is for you. We keep doing this work for you. I'm going to start like I normally start with the Denver Principles, because the Denver Principles were enacted in 1983. And it was a group of people who declared what our rights as people living with AIDS are. And the last line of it says, we have a right to live and die in dignity. These HIV criminalization laws don't allow us to live in dignity. It casts a shadow over our every move, and it causes us to stay hidden in the shadows and afraid. I want to quote something from the Stigma Index. The Stigma Index is a project, a global project, the largest research project of its kind. It was developed, implemented, and carried out by people living with HIV. It started in 2008, and it gathered information about stigma, criminalization laws, discrimination, directly from people living with HIV. Now, the Stigma Index, when it came to the United States, they had targeted cities. I'm going to quote some statistics from Michigan, because it being in the tri-state area, you'll see how this applies to it. Of the people who were interviewed, 38% said that they thought they would be falsely accused. 60% of the people interviewed said that when it came to being prosecuted, they didn't think that they would be given a fair hearing. Now, let's go back. The government has always sent the wrong information to us. If we go back to 1981, when they first started seeing this rare cancer in these five gay men, and then they reported that 41 gay men had this strange cancer. They failed to report in that same calendar year that 86 Black men were also diagnosed with that strange cancer. So they sent the wrong message, which allowed Black people to relax and think that it was just a white man's condition. The same thing happened with these HIV criminalization laws. They sent the wrong message, and our government has failed to correct this wrong. A wrong road is always a wrong road. And as someone who was diagnosed back in 1984, we seem to be responsible for our own sexual health. Even though it was sexual freedom and all, somewhere we took a wrong road. Either us as being elders, maybe did an injustice to the younger people, but somewhere it took a wrong road. Now, when it comes to these criminalization laws, had the government back in 1981 released those Black numbers, they didn't start to release the Black numbers until 1983. So you see the disparity. So we also know that Black people and people of color, marginalized populations, are most impacted by HIV and AIDS, and most at risk for contracting HIV. So these criminalization laws further stigmatizes and pushes people into the corner who are already experiencing social and structural disparities. So it's just compounded by everything else. Also, Black folks and people of color have also experienced mass incarceration, either on a personal level or someone in their immediate family. So this further makes these laws unjust for the people in which we're trying to reach. In Ohio, you can be given 8 years, as you see on the slide, for not disclosing your status before engaging in sexual conduct. At one time, you couldn't kiss someone before disclosing your status. These laws have They were first created when we didn't know much about HIV and AIDS. When the Ryan White Care Act was first enacted, they wanted states to have some accountability, so they put these laws in effect. But we started to see laws in the late 80s that states were adopting on their own. But the government had every chance to right this wrong. When the Ryan White Care Act was reauthorized, they didn't mention anything about the states having this type of accountability. They've had every chance to correct this wrong. A wrong road is always going to be a wrong road until you turn around and go the other way. Now, these laws are very unscientific. Now, on one hand, the government says, when it comes to giving us health care and also providing us with services, they say, oh, you don't need that. It's a perfectly chronic, manageable condition. But when it comes to prosecuting us, they say you hand down a death sentence. You can't have it both ways. Now, people living with HIV are innocent until proven guilty, supposedly under the law. But every person who's prosecuted living with HIV, you're guilty until you prove yourself innocent, which is contrary to what the legal system is supposed to be. So already those marginalized population, Black people and people of color, are already being impacted by systemic and social and structural disparities. We know this. Now, also, U equals U, which is undetectable equals untransmittable. We've come so far with the science. And U equals U is a person who's living with HIV, who's on effective treatment and has a suppressed viral load, cannot transmit HIV to the sexual partners. We know this. These laws came about when there was a lot of fear. Now we need to educate people, and still the branding and the messaging being handed down from those agencies, CDC, other organizations, national organizations, are not penetrating to the people most impacted. The stigma index also said that a lot of people feared going to see their doctor because they thought that their doctor might be called upon to testify against them. Now they did another question in here was, they asked the question of 49% of those people said that they felt that it was not reasonable to delay treatment for fear of being prosecuted. But 51% said that it was definitely reasonable to delay treatment for fear of being prosecuted. Now, yesterday there was a conversation about phylogenetic testing. And phylogenetic testing is a science that can prove, it's just like a genotype. It's something that gives you a profile of your virus. It can prove that it can't prove that you were the person, but it can definitely rule you out as being the person who might have transmitted HIV to that person. Now, there's a big move for molecular surveillance using phylogenetic testing. These same communities that are most impacted, Black folks and people of color, they want to go into these communities to identify clusters of HIV diagnosis by using phylogenetic testing, which is it's like the DNA of the virus, that particular strand. But when it comes to criminalization laws, science hasn't been allowed in the courtroom, especially phylogenetic testing, where you can prove that this person was not the person who transmitted HIV to this person. So the government is sending mixed messages here. On one hand, you want to go into the community and use the same science and expect the community to embrace it. But when it comes to prosecuting that same community, you don't want to allow this science into the courtroom. So these laws are very unscientific. It poses, people are being prosecuted for things that pose no risk. And people are still being prosecuted for spitting and biting and these kind of things. Now, there has never been a study or data handed down that says these laws have done what they were originally intended to do: protect the public. As a matter of fact, it does everything contrary. Now, We are either going to treat HIV or prosecute HIV. We can't do both, one or the other, because one goes contrary against the other. And we definitely, with these laws, and we can't test our way out of this epidemic anyway. So these laws are further contradictory to what we're trying to do. They have the whole ending the epidemic strategy that says that we need to address these laws. Now, these laws continue to impact those people whom we're trying to reach. I don't understand why we can't see this, that these laws are not doing anyone any good. First of all, these laws also say that a person living with HIV, the person whom they disclose to must be mentally capable of understanding what disclosure means. But it doesn't protect the person who is living with HIV, who may have some mental health issues and doesn't necessarily understand the disclosure concept. We've got to understand that just because someone tells you that you have an HIV diagnosis, that you have understanding of that or have acceptance of that. Funding is being taken away from people living with HIV. The government wants you to disclose, but they don't want to make the environment safe for you to disclose. My personal thing is, I disclosed to somebody that I hadn't even held hands with. That night, my car was set afire in my driveway. I spoke at a university, had a heckler in the audience. When I was leaving, I was hit over the head with a tire iron. So they want me to disclose, but who's gonna make it safe for me to disclose? Now these laws are just unsupported. These laws are these laws, the modernization of these laws, or to do away with these laws are opposed by health departments all across the country. But on the home front of Ohio, our state health department, as well as other health departments, have not collectively taken a stand and stepped up. That's not to say that all health departments haven't, but collectively, they have yet to take a stand. Many people go to health departments to get information. And if the health departments are not publicly supporting the modernization of these laws, and we say modernization because in a perfect world, we want to repeal these laws, get rid of them. But we know doing this work that to repeal the laws doesn't mean that people living with HIV and AIDS won't be prosecuted under more severe general laws. So it's best if you're going to repeal and replace, put something in its place, because we still got to educate the public. And if we can't collectively come together with our health departments and other AIDS service organizations and those doing this work to educate the public, but collectively, we must all take a stand that these laws are unjust and not just say you agree with it, but publicly make a statement in reference to this. It's important for organizations or individuals, whether you're living with HIV or not, to visibly step up and support this. Because if it's my condition that they're prosecuting, it could be yours. And this is even more prevalent with COVID-19. So it could very well be you. Now, we understand that. The reason why it's important to educate people, because implicit biases show up wherever we are. It may not be intentional, but people are human and we all have our biases. And what's even more important, that we've got to start looking at this whole epidemic from a lens of racial equity, looking at it in terms of that. If we don't support those people who are most impacted, Black people and people of color, then we're never going to get ahead of this fight. We're never going to get ahead of this fight because Black people are still being prosecuted. If we're most impacted by HIV and AIDS, it only stands to reason that we're most impacted by the prosecution. And mass incarceration is real. And these HIV criminalization laws are just another notch in their belt of ways to prosecute us and keep us further impacted by HIV and AIDS, discouraging people to get tested, not knowing their status, discouraging people to seek treatment. Also, we don't have equal access to treatment for Black people and people of color. So that is what we have to look at. How are we trying to really end this epidemic by anything when we have these archaic laws? Thank you.
Thank you so much, Brian, for sharing that story and kind of giving us a good footing as to where the law is now. Luckily, we have a plan to address these issues, and I kind of want to go point by point about what we're proposing changes. The first thing that we want to see change is eliminating felony penalties that make intentional make that transmission a misdemeanor level offense rather than a felony level offense. We know, as Brian was talking about, mass incarceration is a massive issue in this state and in this country, and we shouldn't be sending folks to prison simply for having HIV. Another change that we're working on is requiring actual transmission to occur in order for a prosecutor to secure a conviction. That's true. That's the case for most criminal penalties. Is there actually has to be some kind of harm done to an alleged victim for a conviction to happen, and that's what we want the case to be with this issue as well. Our proposal also accounts for use or attempted use of reduction measures. So that could include use of a condom, other barrier protections, using PrEP or PEP, making sure folks are on their medication, and also this concept of U equals U that Brian talked about. If folks are taking the measures that they can to ensure that HIV is not transmitted, our laws should account for that. And this goes to the modernization conversation, is when these laws were originally passed, we didn't know about U equals U because we didn't necessarily have the science to make sure that folks aren't transmitting the virus. So that's kind of the thinking behind a lot of these changes. And it also requires specific intent to transmit in order to convict. Kind of goes with this second point about there has to be actual harm done, and there has to be an intention to do harm. A couple more aims that we're looking for with this legislation. It's going to remove the penalty enhancement for sex workers living with HIV, for solicitation, loitering to solicit, and prostitution. Criminalization of prostitution, essentially these laws increase penalties just because a person charged with prostitution offenses has HIV, which, as we've been talking about throughout this conversation, is simply unjust. Also, we're looking to remove the felony enhancement under the bodily fluid statute. This is often used to increase prison time for those who are currently incarcerated. We don't want a person's HIV status to be the reason why they are charged and convicted with a felony rather than a misdemeanor for a person who would have done the same thing but isn't living with HIV. Also removes the current sex offender registration requirement for those prosecuted under any of these laws. That's one thing that I'm not 100% sure if we addressed earlier, but essentially if you're prosecuted under any of these laws, you have to register as a sex offender, which really has a massively negative impact on the lives of those folks who have to register as a sex offender. And it also removes Ohio laws banning blood and organ donation for those people living with HIV. That ban is just not necessary because of the stringent testing that that agencies that collect blood and organ donations do. It's just not a problem. They're testing the blood and organs that are donated. So it's not an issue that those donations are safe. And those agencies are making sure that. And I'm gonna go ahead, I think, and pass it to Marguerite.
All right, hello everyone, good afternoon. Just because it's been a little while since the intro, my name is Marguerite Schauer. I'm a staff attorney with the Center for HIV Law and Policy. I am in New York City, and CHLP is a national partner to OHMM, and happy to be here discussing a national perspective on these laws. Just really quick, one thing I would add about the proposed changes that OHMM is making to the laws in Ohio, specifically on the felonious assault HIV specific offense. Currently, it applies to sexual conduct, which is defined broadly enough to include behavior that has a negligible, if any, risk of transmitting HIV, like oral sex, and just an additional change in addition to all the important changes that were just outlined by Dominic. The conduct that would come under the statute with the reforms OHMM is suggesting is going to be limited to vaginal and anal intercourse and not cover behavior that has a negligible risk of transmitting HIV. My purpose here is to give a broader outlook, a national perspective on the criminalization of HIV. So just what we're talking about when we talk about HIV criminalization is the arrest, prosecution, and incarceration of people living with HIV for acts that are either legal or less harshly punished for people who have not tested positive. HIV criminalization happens whenever the criminal legal system treats someone differently based on HIV status alone. And this can happen in many different ways, and unfortunately it does happen in many different ways just within Ohio, whether it's treating someone differently when they're arrested for a sex work related offense, or requiring that someone has to disclose, no matter what their personal situation is, in order to not fear prosecution when they're a person living with HIV. 32 states have HIV specific laws that impose criminal penalties, meaning laws that impose misdemeanor or felony punishment and explicitly target HIV. These laws, depending on the state and just kind of the statutory scheme, can be found in criminal codes and public health codes, but the key to calling them criminal laws is that they impose punishment, that someone could be incarcerated for those offenses. Some of these laws define criminal offenses for exposing others to HIV, and others outline harsher penalties for people living with HIV for acts that are already considered crimes. So another aspect of HIV criminalization that we didn't talk about today that exists on the national level is sexual assault, illegal for anyone to commit, but due to sentencing schemes, more harshly punished when committed by someone living with HIV. So this is a map of HIV criminalization in the United States. You'll see 28 states, including Ohio, have these HIV-specific criminal laws, and kind of like we've said, in Ohio, there's several HIV-specific criminal laws. So the felonious assault HIV-specific offense we've heard a lot about. 3 different prostitution offenses, engaging in sexual activity for hire, soliciting to engage in sexual activity for hire, which is an offense I've seen, unfortunately, lots of media coverage covering arrests for that offense in Ohio, which often entails soliciting an undercover officer, getting charged with solicitation for prostitution. Notice that no sex happened, that no behavior that had any remote chance of transmitting HIV happened. Yeah, that's a felony just if you're living with HIV, a misdemeanor if you're not. Ohio is also one of our states here, one of 25 states that has used general criminal laws to prosecute people living with HIV. So in addition to having HIV-specific laws, using a law that doesn't mention HIV against someone living with HIV because they're living with HIV. So in Ohio, that actually interestingly refers to another section of the felonious assault statute. So there's the one section of it that specifies HIV is HIV specific, can only be applied to people living with HIV. And then there's one that felonious assault with a deadly weapon. There have been a couple cases of the bodily fluids of a person living with HIV being considered a deadly weapon for purpose of prosecution for felonious assault. Tend to be cases involving police officers, but it doesn't have to be under the law if you are a person living with HIV. And that's not to be confused with the on-point criminal offense for harassment with bodily fluids, which is a more serious offense for a person living with HIV. And I just want to clarify something. It might not be a question anyone had in mind, but you'll see the other category covered on this map that I touched on briefly is states with enhancements that are HIV specific. So something's already a crime, but it's a more serious crime for people living with HIV. I know a lot of the laws we've talked about today sound like that kind of law, and they are functionally similar, right? All three of these prostitution charges that are a misdemeanor as the default, but a felony for people living with HIV. That sounds like an enhancement. The only reason it's actually an HIV specific criminal law is because it's its own section that only applies to people living with HIV. And then it's kind of this separate category, these sexual assault, actual just enhancements under the sentencing laws. So I included this other map, which shows states that criminalize viral hepatitis, just because it's relevant since Ohio is one of those states. And so I just want to point this out because it's not necessarily something that gets brought up all the time. All the 12 states here are states that in their very same laws that criminalize HIV also criminalize viral hepatitis, whether it's hepatitis B, hepatitis C, or not specified. So in Ohio, it's not specified. There's a provision that applies to a hepatitis virus, so it could be any hepatitis. And the law that actually applies to both HIV and viral hepatitis is actually that harassment with bodily fluids statute. There's a lot of laws in Ohio, so it's easy to get them confused. But that's a law that applies to any bodily fluids, including ones that are unlikely to transmit HIV, like urine and feces. And that is a very serious offense if committed against an officer. And just overall, like anecdotally, nationwide, when data has looked into enforcement of HIV laws, laws dealing with spitting on officers tend to be some of the most commonly enforced laws. And also, just while I'm on the topic of overall trends in enforcement, I know OHM is working very hard on gathering data about enforcement. But I would just say anecdotally, as you know, at CHLP, we regularly monitor media coverage of prosecutions for HIV-related crimes. They come up in Ohio quite a lot. I would say anecdotally that Ohio is not a state where you have to wonder if these laws are being used, and multiple laws are being used. So exposure offense, a couple weeks ago, I think Zach mentioned. I think even more recently, actually, I saw an incident of one of the prostitution offenses being being prosecuted, and there have been a few of those in my relatively short time at CHLP. So these laws are definitely being used, which just shows how important OHMM's work to reform them is. So I gave a national perspective on the criminalization of HIV, and just because it's something that people ask about a lot, I want to provide a national perspective on the movement to reform these laws. So going back in time a bit, 8 states significantly reformed their laws in the years since 1994. Now, the history of HIV laws is incredibly complex, and there's not nearly enough time to cover it as far as when they were passed. It's not a simple story of them all being passed in the 80s or anything like that. And as far as reforms, there have been many more than we even talk about, and they're not always great, and they're not always worth celebrating. But the 8 really significant reforms since 1994 in Texas, Illinois, Iowa, Colorado, California, North Carolina, Michigan, and most recently in Washington last year. Reforms that have ranged from total repeal, which isn't necessarily as good as it sounds, because total repeal comes with certain problems I'll get to on the next slide, to more modest reforms that didn't go far enough. I will say that OHMM's proposals accomplish all of the key elements of effective reform as far as HIV goes, and some of the issues we've seen with reform not going far enough in other states, as far as being sure that no exposure offense is anything but a misdemeanor, to reflect that HIV is not a death sentence and to be proportionate with the harm caused, misdemeanor only, intent required. In Ohio, they use the term purposely rather than intentionally as their mens rea element in their criminal law, and actually under what OHMM is proposing, both purposely transmitting and having a purpose to do harm are required, which is so important. And purposely transmitting, that means actual transmission is required as well, also incredibly important. And providing defenses. Right now there's a defense for disclosure, but as everyone knows, and as I think has been said, disclosure can be very hard to prove in court when these are conversations that happen in private. And under OHM's trade changes, I shouldn't talk too much about them since I think this was covered. We see more defenses for means to prevent transmission. So there was a little discussion about U equals U, but the law that OHMM is proposing provides a defense for using any means to prevent transmission, which is important so that because it goes towards a lack of intent to harm. So it's important for anything someone did to try to prevent transmission to be acknowledged as something that shows that they did not intend to harm. So many states, in addition to Ohio, are actively growing coalitions and challenging current laws. States that the Positive Justice Project is working with include Nevada, Tennessee, Louisiana, Georgia, Arkansas, and Missouri. And I know laws have recently been proposed in Illinois and Virginia, and that might be something we talk about. So reform is underway in those states as well. So this is a timeline. I won't go over it all in detail. I just want to highlight a couple of things, a timeline of what I talked about as far as reforms other states have seen since 1994, starting with Texas. There was a total repeal of an HIV-specific law. Unfortunately, people living with HIV continue to be prosecuted, and so what this is kind of a warning about total repeal. People can be prosecuted under general criminal laws when there's no specific law on the books. So that's why OHM's strategy is a good one as far as significantly narrowing the statute, making it a misdemeanor as opposed to total repeal. So 2012, Illinois, but as I said, Illinois is engaged in reform activity right now because prosecutions continued. Iowa is a state that, like Ohio, had sex offender registration requirements and got rid of those, and that's another very important aspect of OHMM's proposals. A kind of warning from Iowa is that they came out with an improved law, but it's still possible to commit a felony. And so that's an important aspect of the changes we're talking about here. So 2017, significant changes in California, including getting rid of some of those sex work, HIV specific laws. And most recently in Washington has a misdemeanor offense, similar to Ohio's, a very narrow offense now. They do still have a more serious offense that's very narrow and could only be committed in cases that would likely be crimes anyway because of transmitting to a child or vulnerable adult. I shouldn't get too much into that, and don't want to run out of time.
We do have a couple of questions.
So someone asked the question about how it could be illegal under a person with disability or something to that effect. Can somebody read that question in the question and answer thing?
I could read it. I see it.
Yeah.
If this is what you're talking about, Brian, I'm surprised that these laws aren't considered legal discrimination against a disabled person. How does that work? Have these rules been ruled constitutional?
Well, I do know that the Center for, you're from the Center for HIV Law and Policy. There was a particular case where the Center for HIV Law and Policy helped prepare an amicus brief on behalf of a guy that was locked up in Ohio, and they challenged, his lawyers challenged freedom of speech. If you have freedom of speech, you're forcing a person living with HIV to speak when it should be your decision. And also, they also challenged the American with Disabilities Act. Both were shot down. And I'm not a legal person, so Marguerite might be able to address that more, but I did want to say a few things that, as much as we like to think that these laws are locking up that person who's running around transmitting HIV to everyone, it's not. People, everyday people who are law-abiding citizens, who are doing everything they can to suppress their virus and live a normal life, are people who are being targeted. Women are being taken away from them, children because of prostitution. People who are in abusive relationships are being blackmailed to stand to those relationships. Audre Lorde says, if you don't know your rights, you don't have any. I think it's important that people need to know their rights. It's amazing to me how at Gay Pride, how many LGBTQ people don't know that these laws exist. And individually, in our own little space, many of us are prosecuting people living with HIV. They're the judge and the jury. And what I mean by that is, we need to start using correct language. People language first. I'm not an HIV positive person. I'm a person living with HIV because I'm more than just my status. I'm not infected. I contracted HIV. I don't have a disease. I have this HIV diagnosis. Also, when we use the word disclosure is telling people that HIV should be a secret, because the definition of disclosure is new or secret information. So we are constantly stigmatizing and prosecuting people. Even as you talk to your clients, you talk about them being positive and you need to disclose and you need to do this. Step back and give us our respect and dignity. And then you can join forces with us to help change these laws. Thanks.
Just as far as the question about disability challenges, it's an excellent question, and I believe there are great arguments that these laws amount to disability discrimination, even Ohio's. And as Brian said, the laws are still on the books, right? So they haven't been successfully ruled unconstitutional. And if it's been tried, there have been more constitutional challenges, I believe, for like free speech, under the idea that the compelled disclosure is a different kind of free speech issue, right? It's the government saying you have to say something. So there have been challenges along those lines, I think, in Ohio, and the courts have found, have upheld the laws. But I think there are disability issues that should be explored. But I think this gets to something Zach touched on up top about, legal versus legislative strategies. We're really talking about legislative strategies, like trying to change the law today. And it doesn't in any way discount any possible legal challenges, of which there are many, because these laws are so unjust.
Thank you both. We do have a question that's interesting that I'd like to get your take on, and it's how would intentional HIV transmission work with someone who does not have HIV to someone who has HIV? The example they give is like, say on a Grindr, if there's someone who requests to have sex and their aim is potentially to contract HIV for housing benefits or something like that.
There is a group of young people that they call bug chasers. Now, there's a different group of bug chasers that are in New York where people are purposely trying to contract HIV. But we've got to understand the young people who may be considered bug chasers. We put a negative connotation on that, but these young people have been kicked out of their house for exploring their sexual identity. So now they're homeless. And so now they're survival sex. They're having survival sex. And so they're doing what they can to have a meal, to have clean clothes, and those kind of things. And nothing could be worse than what they're doing, than what is taking place in their life. But then they run into a friend and say, I have a friend, at least he gets food stamps, he has housing, he has HIV. Nothing can be worse than what I'm doing now. So maybe if I go ahead and get HIV, at least I'll have a place to stay. Also, another problem is our government is sending mixed messages, especially when it comes to Black people and young people, young MSMs, that's what they call them, men who have sex with men. You can't reach those people because what you're doing is reducing everything that these young men do to just sex. I don't care if you have sex with somebody different every day. It doesn't discount the fact that you may be searching for love. So they also say that 1 in 2 young men between 13 and 24 will contract HIV in their lifetime if they don't change behaviors. They put the second part as an afterthought. They need to start saying that 1 in 2 Black young men do not have to settle for an AIDS diagnosis because they can change behaviors. The way that the branding is done, young people are thinking, damn if I do, damn if I don't, I might as well just get it because 1 of the 2 of us are gonna contract HIV. So a lot of people on Grindr are doing these hookup things, and the problem with these laws is it puts all the weight on the person living with HIV. Now, even if you disclose your status on a hookup site, clearly there, you have to, currently, you cannot prove that the person whom you hooked up with actually read your status. You can't prove that because a lot of times people don't read the bio stuff, they just look at the pictures and so you can't really prove that. So you're constantly fighting an uphill battle unless you get that person to go to your doctor's appointment. And usually when people are hooking up late at night, 2, 3 o'clock in the morning, who are you gonna get, the bartender to sign a piece of paper for you? People are, and when drugs come into play, that's why we're saying we should all be responsible for our own sexual health.
I just want to add, I think this question is a really good illustration of the difference between the current law and the changes that OHMM is proposing. So just if the question was, I know Brian touched on a lot of aspects of the question, but if the question was, could someone be prosecuted in a scenario, like a hypothetical scenario, where I guess someone who would be the alleged victim purposely was trying to contract HIV for housing, and I assume had sex with a person living with HIV. So under the current law, as it exists today, a prosecutor just has to prove a person knew they were living with HIV, had sexual conduct, which we know is broadly defined, without disclosing. So either they didn't disclose, the person living with HIV didn't disclose, or they can't prove that they disclosed. The prosecutor does have to show that someone, I'm sorry, the law just gets complicated, don't mean to make the answer long, but the prosecutor does have to show sex without disclosure, unless they show something Brian touched on, like a kind of partner who couldn't consent kind of situation. But they have to show generally sex without disclosure, but that could mean testimony of the person, and who knows what's correct. So the short answer is yes, someone could be prosecuted for that under the current law, and absolutely not under the proposals OHMM is suggesting, assuming the person did not intentionally transmit HIV. So that's why it's so important to require intent to harm and intent to transmit.
I would like to add that currently the laws are not about transmission. It's simply about the fact that you did not disclose. Currently, if I'm a person living with HIV and you're a person living with HIV, I disclose to you, but you don't disclose to me, I can prosecute you. Because it's about disclosing. It doesn't matter if transmission is even a risk. We both have HIV. Why do I need to tell you? The law is about not disclosing, period.
And while we're there, I will kind of add, there's a question I think that closely relates, and Margaret, you might be able to speak to this a little bit better, but Shelley Harrison-Turner had asked, if someone had previously shared their status and it had been documented, but the relationship did not work out, can an ex-partner come back and try to prosecute the person living with HIV if it's been years since the sexual relationship?
Well, we do have a specific case that this happened. Dr. Ann Avery had a specific case where a guy was being prosecuted. Him and his girlfriend broke up, and she wanted to prosecute him. Dr. Ann Avery was the guy's doctor. She was able to come to court and say, no, this young lady came to his doctor's appointment and I have it documented. So they had to throw the case out. So it does happen all the time. People lie, people blackmail you. So it does. Most of these laws usually about get back, people trying to get back at you.
So it sounds like in that question, there's maybe two pieces of it. Like one, would an amount of time matter if it's been years since a sexual relationship? And then two, if there's documentation. Documentation could go a long way, as Brian just said. The other question is one I was going to say I don't know how to answer, because I would need to look up the statute of limitations on this offense in Ohio, and I'm actually not sure. And I don't know how many years it's been in this scenario, but documentation could go a long way, but I don't know what kind of documentation we're talking here, so I won't get into it too much. Could go a long way, but it's still a law that hinges on disclosure, leaves people open to being prosecuted. It can be difficult to prove, and depending on what the documentation is, it could not be enough.
The doctor's documentation is probably one of the more valid ones. It's probably the only one that probably wouldn't be challenged, but you never know in the court of law, because a lot of times we know that a lot of people don't take these cases to trial. Plea bargaining is the biggest tool of our judicial system, and a lot of times people will plea bargain and never get a chance. So no one will ever get a chance to hear the evidence. They will scare you so much that before you'll be sitting in prison for 5 years and don't know why.
All right, thank you to our panelists for this discussion today. We are at 1 o'clock. And thanks to everybody who joined us. I will be putting the link in the chat again, so if you're seeking CEUs, please use that link, and we'll leave this up for a couple minutes so that you have an opportunity to grab that. Again, this was recorded and it will be available on the OHMM website in the coming days.